Good morning, students. Today, we are going to learn about chronic obstructive pulmonary disease.
Another lecture already?
Quiet down and take notes.
Chronic obstructive pulmonary disease, better known as COPD. Oxygen is a crucial part of our lives. People need oxygen in order to live. The process of respiration is critical because it is the foundation through which vital gases move through the air and the blood. The production of energy in the body depends on oxygen, which is bought in the body by inhaling and exhaling oxygen. Oxygen is also important because it is the fuel for cells. Furthermore, exhalation removes waste products out of the body and into the air. The process of respiration utilizes the respiratory system, and it is essential that it is maintained to stay in good shape and free of obstruction. This presentation will analyze COPD in depth and go over various attributes, factors, information, and programs that will give you a better understanding of the disease. This presentation will also enable you to define COPD, recognize its symptoms, and have a general knowledge about its progression, stats, and research. This is an overview of the table of contents. Feel free to address the table if you feel lost. Main characteristics of COPD. Many characteristics and definitions of COPD exist and can easily be applied to chronic asthma. This often delays and makes diagnosis quite difficult. It is for this very reason that it is important to know the main characteristics that not only characterize COPD but also separates it from respiratory disease with similar symptoms. With that said, COPD is a preventable disease. It is characterized by persistent airflow limitation that is usually progressive and not fully reversible. It is also associated with an enhanced chronic inflammatory response in the airways and the lungs to noxious particles or gases. To add, exacerbation and comorbidities contribute to the overall severity in the individual patient. Pathogenesis of COPD. By the way, pathogenesis, for those of you that don't know, is the manner of development of a disease or condition. Now, COPD is an umbrella term used to describe progressive lung diseases, including emphysema, chronic bronchitis, refractory asthma, and other such conditions. Many people mistake their increased breathlessness and coughing as a normal part of aging in the early stages of the disease. They may not know it yet, but they could have the possibility of being affected with COPD. Most cases of COPD are caused by inhaling pollutants that include smoking, cigarettes, pipes, cigars, and secondhand smoke as well. Fumes, chemicals, dust, which are found in many of the work areas, also contribute to the development of COPD. Genetics can also play a role in an individual's development of COPD. COPD is a multi-component disease, and these components affect both the lungs and organs outside the lungs, and can be of either structural, including airway remodeling, emphysema, skeletal muscle wasting, or functional in nature, with inflammation, apoptosis, and senescence. Furthermore, these components are interdependent in a closely linked cycle. Signs and symptoms for diagnosing COPD. Early signs and symptoms include coughing, wheezing, tightness of the chest, and dyspnea. Dyspnea is having difficulty breathing. Chronic cough occurs due to it's a natural reaction because the airways are narrowed, and coughing also removes the carcinogens or the phlegm from breathing passages. The lungs will produce additional mucus to trap or keep inhaled particles out, and wheezing results from the narrowed obstructed airways. And inflammation and irritation can occur from years of smoking and can lead to excess mucus that obstructs the airways and causes spasm within the narrows. If you have these primary conditions, the doctor will then measure your breathing volume or x-ray your chest to determine if you have COPD. The test that doctors usually administer is spirometry, and it tests how effective the patient's lungs are, how much air the patient inhales, exhales, and how fast their respiration system is. If after being administered a bronchodilator, the amount of air forcefully exhaled in the first second is less than 70% of the air inhaled, there is a very high chance that the airflow through the lungs is blocked and the patient has COPD. Descriptions of epidemiology. There are more than 65 million people who suffer from COPD worldwide, and it continues to grow. In 2002, COPD was the fifth leading cause of death worldwide, and unless serious action is taken, it is expected to be the third leading cause of death by 2030. Approximately 5% of all deaths worldwide is due to COPD. COPD was commonly occurring in men. However, due to an increase in tobacco use by females as well, an increase in exposure to air pollution worldwide, the disease has become common in both genders. The prevalence of COPD in Canada is approximately 4% based on surveys and self-reports. However, this number is expected to be higher as most individuals do not even realize nor are they diagnosed with COPD, even though they suffer from it. Approximately 2.6 million Canadians aged 35 to 79 suffer some form or characteristics of COPD. How is COPD consistent with chronic disease definition? Well, chronic diseases are diseases of long duration and they're generally slow in progression. COPD is a non-specific term referring to a set of conditions that develop progressively as a result of different disease processes. Individuals affected with COPD are at a higher risk rate of developing other chronic diseases associated with it. These are known as comorbidities, and this includes anxiety, depression, bronchitis, lung cancer, emphysema, and osteoporosis. Comorbidities. As I mentioned before, comorbidity is the simultaneous presence of two chronic diseases or conditions in patients. So, as you can see here, depression, osteoporosis, weight loss, muscle weakness, lung infection, angina, diabetes, and peptic ulcerations. Common comorbidities. Osteoporosis. A common comorbidity for those living with COPD is osteoporosis. Osteoporosis is characterized by a decrease in bone mass. In a given population, about 45% of those with acute COPD also have osteoporosis, and about 22% were osteopenic, and therefore on their way to developing osteoporosis. This means that more than half of those coping with COPD are also dealing with lower than normal bone mass. As a result, 41% of COPD patients have one or more vertebral fractures. How is osteoporosis linked to COPD? Well, keep in mind that osteoporosis is a disease in which the mineral density of the bone is low compared with what is expected as a result of the normal aging process. The consequence of low bone density includes an increased risk of fractures. Vitamin D deficiency contributes to the onset of osteoporosis. It is thought that since the drastic lifestyle changes that come with COPD result in a decreased ability to partake in simple day-to-day activities such as preparing nutritious meals and going outside, dietary vitamin D and sun exposure is limited. It is also important to note that physical activity plays a notable role in maintaining normal bone mineral density. Due to dyspnea and severe breathing complications, it becomes extremely difficult for COPD patients to engage in adequate physical activity. The links between COPD and osteoporosis have encouraged more healthcare professionals to screen for early signs of osteoporosis. Rehabilitation strategy. Disabilities secondary to COPD. There are various types of disabilities that are associated with COPD. Some examples of these disabilities include pneumonia and increased risk of osteoporosis, which is the thinning of the bones, especially when taking oral corticosteroids. Depression and anxiety, cor pulmonale, which is failure of the right side of the heart. Collapsed lungs, which is caused when damage to the lungs allow air to leak into the chest cavity. Sleep problems, because without enough oxygen in the lungs, it's harder for us to sleep. And problems with weight, depending on whether chronic bronchitis or emphysema is the main part of your COPD. Chronic bronchitis also causes weight gain, while emphysema causes weight loss. Depression and anxiety. Depression and anxiety have been known to be very common comorbidities in patients with COPD. It is very important to treat comorbid anxiety and depression disorders in patients because leaving it untreated can have devastating consequences, and it can come in the way of treating COPD. These symptoms in COPD patients is hard to identify because of the overlap between the symptoms of the diseases, although it is critical for the quality of life. Studies have shown that people with severe COPD are twice as likely to develop anxiety and depression disorders than those that have mild COPD. Although the exact cause of symptoms are not known, there are some variables associated with depression, anxiety in COPD patients. This is a table showing a few examples of variables that are associated with depression and anxiety in patients with COPD. Pulmonary rehabilitation. Pulmonary rehabilitation, also known as PR, is a program that helps patients suffering from COPD, and studies have supported PR for treating COPD patients with depression and anxiety. This is a program of exercise, education, and support to help breathe easier, and is used with medical therapy that includes exercise training, nutritional counseling, education on their disease, energy conserving techniques, breathing techniques, and psychological counseling and or support groups. It also requires a long-term commitment from the patient and the healthcare provider. The program helps clients improve lung function, sleep, breathing, and oxygen intake. Other treatments also include smoking cessation programs, which reduces the toxins entering the body, and bronchodilators, which help relax the muscles around the airways and opens them up, which ultimately increases airflow and decreases hyperinflation. Now here's an example of a research publication. So the aim of this study was to determine whether there were any changes in depression and anxiety in COPD patients that were enrolled in a pulmonary rehabilitation program. They did this by collecting information from 101 COPD patients that attended the program, and they assessed the levels of both depressive and anxiety symptoms at the starting and at the end of the program. They also recorded their age, sex, the severity of their disease, and their level of education. They were able to determine a decrease in the severity of symptoms after joining the program, and this helps to prove the importance of pulmonary rehabilitation in patients with COPD. This program would also be able to help patients to better manage their other symptoms, such as any sleep problems, cor pulmonale, as well as they wouldn't be depressed or anxious and lose hope to ever getting better from their illness. This gives patients the motivation to survive. Now here's the second research publication, and the aim of this study was to evaluate psychopathological and physical effects of aerobic exercises in patients with COPD. To do this study, 52 consecutive subjects were used, and at baseline, they were divided into two subgroups. The subgroups consisted of 38 subjects that were depression positive, and 14 that were depression negative. During the study, Hamilton Depression Rating Scale, also called the HAM-D, was used. After the rehabilitation treatment, the psychometric and physical examinations were compared between the two groups. The results suggested that pulmonary rehabilitation improves anxiety and depression in patients affected by COPD. The study suggested that COPD patients that are suffering from anxiety and depression could definitely benefit from a pulmonary rehabilitation program. And these are the references.